We are super, super happy that you all are here today. We built off the UNAIDS Mayor's Meeting, which was really an inspiring all-day session where mayors were talking to mayors and their health departments were talking to health departments. The great news in the world of AIDS is we could end the epidemic. The bad news is if we do business the way we're currently doing business, we're not going to end it anytime soon. And so the MAC AIDS Fund, we are proud to be the largest corporate funder of HIV. We would love some more company. So if folks are in here in the corporate world, we'd love to convince you to join us. But essentially what we're seeing is the poorest of the poor and the most stigmatized folks are not being well served by our systems. So cities really are the hubs of great life, hubs of great joy and diversity, and for our company, hubs of great creativeness and artistry. But they're also the hubs of a lot of sorrow, and people are being isolated and not being served the way that they should be. So the discussions here today and the global discussion really is how do we reorder ourselves, similar to the way that media is being transformed. And we've worked with the Atlantic Live over several years. And what we're also trying to do is sort of get over ourselves, as it were, in terms of traditional media and get out there on social media. So the discussion today really here with some really incredible experts. And, the other piece is that this really is a global epidemic that requires solutions. And so what we've done really is to try and bring in people from different sectors. Folks will probably recognize Annie Lennox. So when we got these microphones, I'm sure she's a lot more comfortable with this microphone than I am. But really, Annie has been an incredible, she's not only long on voice, but she's long on heart. And I love the fact that she always wears this T-shirt. In fact, she came to visit us once at the Estee Lauder headquarters wearing that. Because she understands that media and pictures matter. And the fact that she, as Annie Lennox, is wearing a T-shirt like that really speaks volumes. So thank you for being here today. And also what we've also seen is celebrity is a currency, as Bono once said. Use it. And so thank you, Annie, for doing all this great work. Ambassador Deborah Birx, who's well known and loved as Debbie Birx, has been really just an incredible transformative force, previously at the CDC and is now really in charge of the largest chunk of money that the U.S. gives to any country, our largest form of aid, which is the HIV aid, and has done incredible things. And we're going to talk with you about how you've done that work. Michel, Sidibé, our great friend from UNAIDS, who's been an incredible partner. And thank you, Michel, for all you've done, for partnering with us here, and for getting people into the room who I think have a sense that we need to not just do inside baseball. And so the other piece that we really want to talk about is how cities can make a difference. And the city of Paris has been very forward-thinking. Actually, I was recently working on some energy issues, and you've also were the seat of the, setting a global net zero target for greenhouse gases. So the city of Paris, which unfortunately, as you know, the Seine has been overflowing, and so Mayor Hidalgo could not join us here today. And instead, Deputy Mayor Jomier will be speaking for Mayor Hidalgo. Now, Deputy Mayor Jomier would prefer to speak in French. So do every folks have headsets? Okay, so we're going to kick it off with you, Michel. Also a man of great heart and a minister by training. Is that right?
Sorry?
Are you a minister by training, or did I get that wrong?
No.
Well, you're an incredible preacher. And a preacher, incredibly charming man, incredibly committed man. And under your leadership, UNAIDS really has traveled so far. So could you talk a little bit about the mayor's meeting and what you had hoped to achieve? And basically in this group, some of whom are from the mayor's meeting, but some of whom are just members of the community, what are you really trying to do here today?
No, let me just start by saying thank you to you. Thanks for your leadership. Thanks for MAC AIDS Fund, because you are the leading donors for fast track cities. And for me, it's so important. We have been able to do a lot during the last, I can say, the 35 years. Thanks to global solidarity, thanks to civil society movement, we have been able to reach millions of people with treatment, thanks to the taxpayer of these countries, because without that one, we could have not dreamed to end AIDS. And today we're talking about ending AIDS by 2030, and we will not end AIDS if we are not thinking about I can say that our vision should be completely we should deal with our vision differently. What I want to say, we need to think about people who have been left behind, people who have been excluded, people we didn't manage to reach. And that's why we changed completely the paradigm by bringing location, population, thinking about not just numbers in aggregated manner, but saying where we will reach those people. And city become for us one of the first approach, because in cities, like you said, you have those slums, you have those people who have been excluded, you have those people who don't have access to services, you have those people who are coming with a new energy also. You have growth, you have an institute, you have, they are incubator of innovation. So for me, we need to mobilize those new energy. And that's why I'm so happy also that McFan $2 million to help UNAIDS to convene such of a meeting, bringing leaders from different parts of the world, making sure that we reflect on 200 cities who signed the Paris Declaration, and we translate that into concrete action. Concrete action by advocating for new programs in different cities like Johannesburg, Durban, Shanghai, and I can say Jakarta and Ho Chi Minh. Those are small fund, but catalytic and very important fund to make a difference for people without voice. And that's why I personally feel this meeting is different. It's completely different. It's bringing certainly innovation close to our art, is bringing the fact that we will program differently, is bringing the fact that we will certainly think about results in different manner to really end this epidemic. Thank you very much.
Well, you're welcome. We do it with all humility, and we wish we had more money. But we do think a lot about how to maximize our money. And as a brand, actually, we were founded over 30 years ago by, it was a family business, 2 men who were partners, and their friends were dying of HIV. And we spend a lot of time reminding ourselves where we came from and that our job isn't done yet. And you know, hopefully we are also long on heart, but I think that one of the things that we've tried to show is that from going to one store in Toronto to a $3 billion brand, and what we celebrate really is diversity and difference. But I really want to ask Annie, again, you know, I've been lucky enough to share the stage with you a few times, and I am constantly moved by the fact that you're so moved and that you're so engaged and that you've been engaged for so long. So could you just give us some sense of what brought you to the HIV fight, and what do we have to do to close this out?
Well, I would say I was very fortunate because I live in a privileged part of the world, and as an artist and a communicator, I was invited to come from my privileged world to witness the world of others, the world of the HIV/AIDS pandemic, courtesy of Nelson Mandela, who had at that point realized that in the early 200s that there was a genocide, what he described, taking place in his country. And hearing Mandela himself describe the HIV/AIDS pandemic as a genocide, you know, this word was really catalytic for me, you know. And then through organizations like Oxfam and Comic Relief, they took me to different projects. So I saw the whole picture of the HIV/AIDS pandemic as it plays out. And it's complex, you know, because I wanted to be an advocate. I wanted to speak out. As we say, I wrote this down, people without a voice. Those are the people that I really want to represent. And a lot of those people are women. I'm a woman. I'm a mother. I have daughters. And I have witnessed all around the world, I have seen the disparity, the gender disparity that exists. And I felt, okay, this is a very complicated issue. How can I stand and represent everybody here? So I thought maybe if I can represent my gender, my humanity, my motherhood, maybe I can speak for, you know, become one voice that is representing a collective voice. And when you see the pain, when you see the loss of life, when you see the hideousness of what this pandemic really looks like, and the stigma and the silence, it is, as an advocate, it is so painful. The pain does not go away. I carry that pain with me, you know. And it's strange to say, in 2003, the fact was that HIV and AIDS was the leading cause of death of women of reproductive age. It is the leading cause of adolescence in sub-Saharan Africa still. In 2016, that is the strapline for me, and I want to scream it, you know. I really want to scream it. In this country, all those years ago, I was around a young woman in my 80s. Thank God that the gay community were able, they were dying, and they were coming to Wall Street, and they were fighting. They were lying down on the floor. They were saying, we are dying. And it's a miracle, in a way, that they managed to coalesce and have this voice, and they are the reason why we're here today. They are the reason why we have access to treatment. And, you know, earlier today I was quoting, 5 years ago, 7 million people, right, had access to treatment, and now it's 17. This is incredible. So when Michel, who is absolutely Herculean, his task is extraordinary. Your task is extraordinary. I see him work so hard. What I do is very small, but what he does is exceptional. And he and UNAIDS have facilitated this change. And we know wherever we go, we say, we can do it. We have the tools. The medication is there. It's possible. All we have to do is have the political will. If I think about the fact that we could slide all the way back down the mountain, and all the accomplishments, all the investments that have been put in are for nothing, that we've thrown that baby out with the bathwater, it is not only devastating for me as an advocate, it's devastating for millions of young generation of people coming up, mothers, children, girls, daughters, men, boys, the whole lot. We can't afford to let it go back to what it was before.
Amen. What a lovely, lovely.
Thank you.
So, one of the, again, the mayor of Mumbai was not able to join us, and we're so privileged and happy that Ambassador Birks could join us. And she has been an incredible leader. And the fancy term, I think, is geo-targeting. But what's amazing to me, as someone who also lives in a business, is she's thought very hard about markets. She's thought very hard about the customer is always right. And she's thought very hard about how to resource the epidemic to end it, and not just have a continuing stream of aid. So why don't you talk to us a little bit about your geo-targeting, and right as we were walking in, you were talking a little about your work in Latin America and the Caribbean.
Yeah, no, thank you. I'm just, when we talk about leadership, when Michel met with a group of scientists and said, I think we can end this epidemic, people laughed at him. I'm really, they didn't realize that this could really happen, because not all the data was available yet. Yet he went way out on that limb, and I think when they wrote that fast track document that showed we were headed to 100 million total HIV infections, it was a huge wake-up call for me, because here we thought we were doing great. $70 billion investment in PEPFAR, $55 billion just since President Obama took over, a real bipartisan peace, the taxpayers walking with us, and then, just as Annie said, we were headed to this cataclysmic cliff, which to me was an emergency again. So we started to dig into this, because we always dig into the UNAIDS data. It's always perfect, but we always dig into it. So we were digging into it and realized that what was driving that is the success of the MDGs.
Yeah.
So because we saved all these children under 5 with immunizations, with malaria, with PMDCT.
Those are the Millennium Development Goals, which are the
They
forebear.
were our construct from 2000 to 2015, and they were successful. So we decreased under 5 deaths by more than 65 to 70%. And all of a sudden, they're 15. And by another 5 years, 60% of the population of sub-Saharan Africa will be under 18. So we made this huge investment as a global community. And then we didn't have a plan to save young women, to save key population, to save young men of color in the United States. We didn't have a real engagement plan. And it was that was our wake-up call, that we said, okay, what can we do with funding that's fairly level? Because at the same time, no one was dying from HIV anymore. So ministers of finance, prime ministers, presidents were like, what's the problem? Because in Africa before, their staff was dying, so they could see HIV. They can't see it anymore. So they were convinced that this wasn't a problem anymore. So you have level funding and potential for an explosive epidemic. And I think that's when we really realized we had to analyze down to the site level, the most granular point. We have every single PEPFAR site mapped, in the world. So if you go onto pepfar.gov, look at our maps, you'll see every one of our sites. So you can say, that's not a good place to have a site. No, but send us your opinion. So we mapped every site, and then we got the data from each of those sites, and we got it age, gender, and risk factor disaggregated. And that's really why the mayor piece is so critically important. Because when you hear them talking about stigma and discrimination, when you hear them naming the risk groups and the risk populations, it's that combination of behavioral data with epidemiologic data and the political leadership that will get us to the end. And it has blown us away how incorrect our assumptions were. Absolutely incorrect. Every key population in every community has a different reason for being behind. In some cases, it's testing. In some cases, it's linkages. So if you go with a generic approach, you'll never find the solution. It's like if you only had, now I love blue mascara, but some people don't. I have it on today, including my daughters, who are like, why do you think it's, the 1960s and 70s still? I'm like, because I liked it then, I like it now. I'm just continuous.
Stick with a winner, right?
Stick with a winner. But if you didn't have brown and that super black mascara, people would be like, I'm not going to buy their mascara because they only have one color. We have tried in HIV to take a one-color approach, and we're learning now that what resonates with a 16-year-old girl is different than what resonates with a bisexual in Rio de Janeiro and someone in South Central LA. And it's only through that very locality analysis that you'll come to the solutions. We also believe the solutions are there. There's so much innovation in the field, but every time I find it, they go, doesn't everyone do it this way? So everybody is so humble. So our job is to take those amazing excellence and get it everywhere and to see if it's adaptable to different communities so people can look and see. And that's all it is. It's looking at the individual level and meeting them where they are.
Well, thank you also. I am also just always struck by your humility. I think over the course of the epidemic, we've wanted to have centers of excellence, and we've wanted to have big, iconic models. And going back again to the customer and the customer being different, I think we've had a lot of difficulty, because AIDS is a behavior-based disease, listening to folks, honestly, who are at risk. And also, I think in terms of what's great is the pharmaceutical companies have made such incredible advances in terms of treatment and treatment as prevention, and yet the behavioral issues are still, I think, sort of in our way. The ambassador and I and Annie were talking about our children and how there's a way in which, my son said, we just have to get over ourselves. I think there is a way that many folks who are currently policymakers are really not thinking about people's lives in a loving and accepting way. And our diversity, I think, really does make us stronger. So we have been privileged, as Michel indicated, to be partnering with cities and basically going city by city to talk with the mayors and their teams and say, what do you need? We understand that government funding can be very rigid, and it often creates pockets where, sadly, some of our folks are falling into those pockets. What is it that you need to help you end the epidemic in your city? And so we're doing that partnership with Paris. And Paris is an incredible city and incredible amounts of leadership. So if you could talk a little bit about some of the work in Paris and how you think people in the room might be able to help. No one is leaving here without an assignment, by the way. That's the mark of a great meeting.
Okay, thank you very much. So I try to speak in English, but if I can see on your face,
Franglish. Maybe I can help
If I can
out.
see on your face that you really don't enjoy my terrible French accent, so I can switch
okay.
to French.
Yeah.
Don't worry about that. So thank you very much, because this day was a very good day. It was a very good day because I feel member of a community of people involved in this very important fight, major social and societal fight against AIDS. This community is made of cities, is made of NGOs, of patients, of activists, and what is very important for us is that all of these actors are necessary to win. And today was a good day because I think we progressed with all of intervention. First of all, permit me to really thank Atlantic, the Atlantic Live and Mac Headphones, of course, for organizing these events. Thanks to Michel Sidibé, who carries and supports this dynamic with all cities.
You should be a lot
involved.
older for all that you've achieved.
Yes. Our citizens need to be aware of the city's commitment and the policies they develop to ensure united and inclusive society, and that's a main challenge. This event is a great opportunity to share new ideas and innovation, and tomorrow we have again a breakfast against this idea of innovation in this fight against HIV. And as a core partner of the Fast Track Cities initiative against AIDS, I'm very proud to be here, especially to announce with you the partnership between the MAC AIDS Fund and the City of Paris. Thank you very much to your support. Paris will put AIDS epidemic in the past once and for all, I promise you. Thank you very much for trusting Paris. I can guarantee we will success. For us, for the Mayor of Paris, Anne Hidalgo, and for me, it's a top priority. And it's a real treat to be part of this forum. Thank you for inviting us to this wonderful event. And I want to inform you of the action taken by Paris, by the City of Paris, to fight against AIDS epidemic a year and a half after the launch of the Paris Declaration. An NGO was created. This association is named To Paris Without AIDS, which aims to raise public and private funds to implement our strategy. We need, of course, as all of cities in the world, these funds. And I'm very pleased to announce today that the MAC AIDS Fund will be the first contributor to this non-profit organization.
I know there's a few foundations in the room. We'd love more company. So if you want to come sit next to me, we can announce your pledge.
So thanks to his support, we can launch the first major action. Starting this fall, the City of Paris will lead a major communication campaign and awareness campaign on available prevention tools, PrEP, self-test, and condoms. And we will expand access to PrEP coupled to other prevention methods. We want to increase the number of screenings, and these initiatives will require increased medical consultation. We will adapt our means of action to different risk groups with 5 programs targeting those most at risk: people living with HIV, gay MSM, migrant people, trans people, and sex workers. As long as men, women, and children will continue to die of HIV, our determination must not waver. We are not allowed to let it happen. To be fully effective, this policy must focus on the alliance of many stakeholders and communities, and that point is very important for us, because by fighting against AIDS, we fight against discrimination and in favor of justice. It's by joining our forces and combining them with the most innovative solutions that exist today that we will succeed in ending the AIDS epidemic by 2030. So thank you in advance for your action and support. We need you, and you can trust us. We will be with you. Thank you very much.
Well, that was far better than my Franglish would have been. You know, the other piece that we really want to emphasize, and I think this morning showed, is that leadership matters. Showing up matters. And what we see are city after city that we have so many allies within government. Literally, we just went with you, and I want to recognize Andrea Flynn in the back of the room, who's been a great leader on this, and she just right before I gave her the compliment went like this to me. So that means we have to tone it down.